Hey guys, before this episode begins, I just want to let you all know that I've partnered with DAT Bootcamp to offer a 10% discount code on all Bootcamp products. While studying for my DAT, I found DAT Bootcamp to be the best resource during my preparation. Their extensive review videos and practice exams are second to none. Use code DOD10 at checkout for a 10% discount, applicable to all programs Bootcamp has to offer. Again, that's DOD10 at checkout. Hey everyone, welcome back to another episode of the Dose of Dental podcast with your host, myself, Suraj Shah. The focus of this podcast is to share undergraduate and dental school experiences from dental students and dental professionals through valuable discussions. Through sharing the journeys and stories of current dental students and dental professionals, our goal is to help you find answers or guidance for your own pre-dental journeys. We're super excited to have Stony Brook Dental School alum and current NYU Bellevue Hospital OMFS resident, Brandon Gallagher, joining us today. Brandon graduated from the Stevens Institute of Technology with a bachelor's degree in chemical biology. He then completed dental school at Stony Brook and is now an OMFS resident at NYU. During his undergraduate years, Brandon played D3 basketball, conducted research, and was a tutor for organic chemistry, along with being part of many clubs and even started a few businesses during dental school. Brandon, welcome to the podcast. Thank you for making the time to join us today. And how have you been?
Been great, man. Thanks for having me. No, first, really, I appreciate you reaching out and helping me schedule this. Dude, I really appreciate this. I hope we can kind of collab, like some chop ups, some posts between students of dentistry, elite dentists, my page, your page. I mean, this is huge. I'm a huge supporter of what you're doing. We need more of this out there. I mean, we really do. No one's doing this. You are.
I think so too, because I mean, even like during, when I decided to go for dental, I was originally med, but I decided to go dental. There was no like resources out there for me. I feel like there was like Instagram pages, but there was no like direct, like contacts with dental students and, professionals like yourself, to really understand what dentistry is like and what the pre-dental process could be for like many different people. So I think that's kind of one of the motivations of starting this thing up. Yeah. So why don't you tell us a little bit about yourself, like, where you're from, what you like to do for fun, stuff like that.
Yeah, man. Well, first off, had to rep since we're coming back to the Stony, coming back in house.
Nice.
There we go.
Nice.
Oh yeah, I got a couple things. I always gotta rep Stony Brook around. Gotta know where your roots. I mean, as far as me, just actually, I was kind of pre-med, pre-health, whatever. I didn't know what I wanted to do at first. Started out at NYU Polytechnic Institute of Technology. NYU Poly actually transitioned to NYU Tandon School of Engineering now. I went there. I was recruited for basketball.
Yeah.
They got rid of the team there after my second year, and it was going well. I had a great group of friends there, great guys. So I transferred to Stevens, and then I finished up there. I actually didn't play my final year of college because I started to transition into I was shadowing over that last summer. I was starting to kind of hone in on what I wanted to do, and just I realized I wanted to go dentistry. I was shadowing dentists or surgeons, and that was really it after I saw those two guys. Dr. Nicastro, actually, believe it or not, he's a Stony Brook faculty member. I hope you got to meet him.
No, I haven't met him yet, but I know of
no?
him. No.
You will. I'll introduce you if we have to. Absolutely.
Let's do it.
And then Dr. Capuano is the oral surgeon from Suffolk County. Yeah.
Nice. Gotcha.
But yeah, you got plenty of time, man.
Yeah. So, Brandon, let's start at the beginning. Why dentistry? What gave you that spark and what's keeping you lit to this day?
Whew, what got me started, it was well, I always wanted to help people go into healthcare, right?
Yeah.
And then I met Dr. Nicastro, Dr. Capuano at the gym. Believe it or not, I used to get up. So they would go to the gym at 4 o'clock, 5 o'clock when it opened in the morning. In high school, I used to get up and go there and do a quick basketball workout before school.
Yeah.
And I saw them in the distance. They had a they had Dr. Capuano's office manager, who was kind of like a heavier set guy, friendly fella, and they used to just rip on him the whole workout, and then other people in the gym would start chiming in like, yeah, we'll be cracking up. And so I was like, I like these guys. Turns out in college, I actually got to meet them. I thought they were construction workers. They would come to the gym in these big pickup trucks, Lincoln Navigators, Jeeps, trucks, right?
Yeah.
They would come in all black. So the gym community called them the Men in Black. And then when I was studying for organic chemistry, one of my friend's moms, who's a nurse, said, "Oh no, they're dentists. Like that guy's an oral surgeon. They got A's in orgo. Go ask them. So I met them, shadowed for them, and I switched from going medicine to dentistry, and here we are in oral surgery.
What year was that of college? That was like junior year?
That was after first year, starting second year. So it was the beginning of summer before my second year of college.
Got you. I think I see Dr. like Nicastro's his name? Nicastro?
Yeah.
I think I looked at his Instagram page and this man's like pumping hundreds, on the bench.
Yeah.
Crazy. That dude's huge. That's nice.
Yeah. You gotta meet him. Guy's a stud.
He's in Long Island.
Yeah, he's
he practiced
Porter Station area.
Yeah, maybe. All right, I'm down to meet him. So like many pre-dentals find their whys in the dentistry like towards the end of their college years. People that are lucky, I guess they realize it earlier, like sophomore, freshman year. So how do you approach like undergrad, knowing that you wanted to pursue dental school, like after you realized you want to go the dental route instead of med school?
Well, that's a great question. First thing was that I knew I'd have to take a gap year, but I used it to my advantage because I was switching from studying for the MCAT at that point to studying for the DAT, right? So I was like, okay, I'm just gonna have to take a step back, figure it out. But I knew I could work in the gap year. I could I could read books, learn stocks. I consume a lot of Gary Vaynerchuk's content. I actually produced some music for that year. I was working 3 different jobs. I was working 2 lifeguard jobs, 1 weekends, 1 weeknights, and during the day I was actually a dental assistant, a surgical assistant for Dr. Capuano. So I was working at the oral surgeon's offices, the 2 offices I was going between. You figure it out, right? Like, you can't always tell what the next turn in the road's going to be. You can see the destination. Sometimes that destination might mold a little bit, but you have to be adaptable. You have to be self-aware, know that you're going to make the most of it. You have to be adaptable to say, this is how I'm going to adapt and make it into something worthwhile. And I must say, I'm the biggest advocate for gap years because that gap year, I got to learn where I was in the scope of the grand scheme of the world, right? Not of the world, but on like the real world basis. If you go through life only being in school, you really only know how to study for that next test, how to interact on a classroom basis, not literally, but figuratively, right? You need to know what's bigger than the classroom.
Yeah, I think it's totally huge. And, for people that, might realize they want to go dentistry like junior year, senior, I mean, gap year is like something they should really probably consider. I know some people that have just gone straight through, but I feel like, if you have time and you want to get more experience and you want to like learn your gap year, I think it's perfect, honestly. So how did you understand you want to go dental. So how did you set up your experiences throughout undergrad to kind of set up that success and make sure you're on track?
In undergrad?
Yeah.
In undergrad, let's see. I mean, it's really just trying to get the best grades you can. It's molding your application towards the school you're studying for. I say the same thing when applying to residencies. You got to kind of see what those people do. So if you're an undergrad, you got to see what dentists do. And then the next step is, well, there are different types of dentists. Have you seen a variety of what those dentists have done? Yeah. What did you like? What did you not like? How do you see yourself fitting into the big picture? And when you figure all these things out, you literally just made your interview scenario, your interview conversation.
Yeah, for sure. So let's go to undergrad now. So you're in undergrad. I know you did some research in there. So can you talk a little bit about your research experience and kind of what kind of role did that play into applying to dental school and just how'd you get the opportunity?
We're hitting all the academic points. Let's do it.
Yeah.
Research, it was great. I worked for Dr. Glavy and Dr. Catabiana at Stevens, and basically I was like assisting a PhD student on all the research she did. She was a foreign exchange student from China who is now pursuing her PhD after finishing her master's, and it was in a lab. We were doing gene amplification of the Werner's helicase gene. The Werner's gene basically. Long story short, we were putting gene amplification on it, so it would light up to see if it made it through the nuclear pore complex into the nucleus of the cell. Turns out it did, and this is a gene involved in aging. And then if you know Werner's disease, Werner's syndrome, I forget the exact. It has accelerated aging. So kind of whether that protein made it into the nucleus or not, kind of showed how the disease panned out. And What relation did it have to dental school? Absolutely nothing. It showed that I got involved.
Yep.
When I stopped playing basketball, that's when I picked up the research project and I really got into that. I had to stay there like 4 days a week over the summer. Not bad, but like early in the summer. Yeah, so I don't know. It was just involvement, right? I actually got an award for it, which was super nice, and I was super appreciative to win the award. I mean, I don't know if I'm being modest or not. I mean, I don't think I earned that award any more than anyone next to me. It was just I was really appreciative to win it, but there were so many people doing research. How do you pick someone to win?
Yeah. Yeah.
But so yeah.
Nice. So how about shadowing and assisting? Did you how'd you get involved there?
Dr. Castro, Dr. Capuano. They had a third guy back then, another Nick. Dr. Castro's first name is Nick. There was another
Right.
Nick Giannuzzi who I shadowed those three guys throughout that summer, actually, when I was working on research. And
Yeah.
so I would work 4 days a week in research. I would come home, I would shadow on Friday, and then Saturday, Sunday, I would work in lifeguard. Yeah.
Do you think like shadowing really just opened your eyes to the different kind of things that you could do like in dentistry? Because you were pre-med before, so did that just kind of like cement your choice going this route?
100%. Yeah. Yeah. You gotta surround yourself with mentors that you admire, that you want to be like, that you look up to, and mentors that are going to mentor you, because that's always another thing that doesn't always pan out, but does. And it did. And that's what I recommend to kids. You got to find a mentor that's willing to stick through the course with you.
Mm-hmm. And I feel like once you find one, like, then you start branching out to more people and more people and more people. Like the doctor I work for right now, he knows Dr. Pruthi, which you know too. And I've been going to him like a couple like maybe 5 times total now. And like, every time I go, I'm just so impressed with how he like can handle patients and how he just like it feels like the job he's doing right now is like his side hustle because the man's in like the OR, he's doing teaching at Stony Brook, he's doing so many different things, and it's like inspiring every time I go there. It just rejuvenates my motivation for doing this.
And you need to keep doing that. He's
Yeah,
phenomenal. Dr. Pruthi, he wrote my letter of recommendation for surgery programs.
it's great. I'm going to him on Friday for my wisdom teeth, I think.
Oh, you really?
Little consult, yeah.
Oh, for the consult?
Yeah, just for a consult, and then we'll see what
Oh,
happens after.
yeah. All
Yeah, yeah,
right.
yeah. I'm excited. I've shadowed a couple of times where he took out wisdom teeth, and I want him doing it. The man for the job. So
Yeah.
yeah, so what were your like major obstacles that you faced like during undergrad? I know obviously you said that you had to transfer into Stevens. So once you got into Stevens, like what major hurdles did you have to overcome just to set yourself up for dental school?
Oh, sure. Oh, actually, this is a loaded question. There were a lot of hurdles in that transfer, especially having done 2 years already and now transferring in as a junior.
Yep.
But I want to ask you a quick question.
Yeah, for sure.
Let's just bring the audience, whoever's listening in, how we met, right? Because
Right.
we
Yeah.
met
Yeah. Yeah.
before,
I was
right?
gonna touch on this. Yeah.
Yeah.
So in ninth grade, I believe. So I just moved. I lived in Jersey in eighth grade, so I moved to Smithtown ninth grade, which is in Long Island. And there was a gym over there called NYSC. I think they shut it down now. I think it's gone.
New York Sports Club, man. They
It
shut it
went down.
down.
It went down. But
That's where I met them, by the way. Dr. Nakash
yeah,
is New York
I'm
Sports
assuming
Club.
at that gym. Yeah. So ninth grade, I was training for basketball essentially at my school. And then, I'm in the gym there and I see this man right here, Brendan. And I don't know, I feel like he looked really familiar for something, but I don't remember. And then like we just started playing and it was a good time. And I think we probably played a couple times there. And then, fast forward to college now. I think my first like pre-dental meeting when I switched into pre-dental, I see Brendan like he comes and presents for us. I think with Sean, I believe.
Yep.
Yeah, he's an ortho resident, I believe, second year.
Yep.
Something like that.
Second year ortho resident Stony Brook. Yep.
Cool. Yeah. So then I see Brendan in the meeting. I'm like, and then I text him after. I'm like, wait a minute, are you the guy from like 4 years ago when you played in the gym? And he's like, yeah, that's him. And it's just like a small word. That was like a small word moment right there. And that's when I just kind of realized like I would never suspect this man is in like dentistry or like doing anything. And I feel like that's how you felt with Dr. Castro and
Yeah.
yeah. So I guess the moral of the story right there is like you never know who you're gonna talk to, and you never know what kind of connections they might have. So it's important to just keep everyone in the back of your mind, if they catch your eye, and just kind of, you never know where life will take you. I guess that's like the moral of the story right there.
Yeah, and
Here
follow
we
the
are.
people.
Yeah,
Yeah, and
now,
all the people you connect with, because we connected through basketball and then
yep,
dentistry, and now we're connecting on. I mean, you're doing a lot with social media. I have a big
yeah,
history with social media. We could talk more about that later
yeah,
because I have some ideas. But oh, and then the fact that just you're realizing that there's a lot more to a person than just their career, or like we're saying in undergrad. And I looked into the last meeting that you had with the last student.
yeah,
Just like you said, there's a lot more to your resume when you're applying to dental school resume, just everything, your whole being, your portfolio than just academics.
exactly. And we had Dr. Kim on. She's a general practice resident. I think she works in Philadelphia now, but Dr. Diana Kim, you might know her.
Yeah, I
Yeah.
understand.
So, she told us that, like, you know, you got to be more than just a bookie, because dentistry is such a social like practice, depending on, like, I guess, where you go, but either way, you're dealing with people. And at the end of the day, if you can deal with paper better than people, there's going to be kind of an issue there. In terms of credibility, connections with your patients, stuff
Yeah,
like that. So, and I
yeah,
even see that when I work in my job too. Like, when I find myself, when I'm stuck in the book studying for an exam or something, I'm not as social to other people, like patients, as I would be if I, where I was actively, being more than my academics. So I think it's a really big part of, and I'm sure you can attest to that too.
oh, absolutely. You got to be a social person. It doesn't even have to do with talking necessarily. It has to do with the appreciation of connecting with another person.
Exactly.
And it's so true. If you really think about it, it's so true because I started out at the beginning of residency, just not it's not about me, but it's the fact that, like, you want to connect with people. Probably 50% or more of my patients here, especially in the Bellevue clinic, they're 100% Spanish speaking.
Right.
And so look, I'm gonna figure out how to speak Spanish. And yes, my girlfriend speaks Spanish, and we're learning. So a little bit of cheats here and there. But the fact is like, no, like every conversation, you're just trying a little more and you're connecting with that patient and they appreciate it so much.
Exactly. And I went on a mission trip to Guatemala. You might have heard. And I took Spanish for maybe 6 7 years, like throughout
Wow.
middle school. No, like through middle school, high school, and, like, honestly, I didn't learn at all as much as I did that first week I was there, because
No
over
way.
there it's just like we live with the host family, right? So the host family only spoke Spanish, so we had to speak in, like, my Spanish got so much better just in that 1 or 2 weeks that we were there.
Oh, I'm sure.
And,
Yeah.
yeah, and then when I come back, our office, we had a couple Spanish speaking patients, and my doctor, Dr. Vinoy, like, he knows how to speak Spanish, and
Fenoy?
yeah, he
Dan?
knows a little bit. Yeah,
Dan?
yeah, yeah,
I
yeah,
know Dan too. Yeah,
yeah.
we used to play
Nice.
ball intramural with
I know. I've taken him to come to the rec, and we play a little bit sometimes.
Oh, dude, I got to get out there to Stony Brook. I'll get
Right.
Sean out. We go play some ball.
Well, yeah, I'm down. He should be around, right?
Yeah,
Tony
Sean,
Brook,
Dan's
so
in the area too. Yeah, yeah.
yeah, yeah, yeah. So so Dr. Vinoy, he was able to speak to the patient, make her understand the whole procedure, in Spanish, and, like, that probably led him to getting the treatment. You know what I mean? Like,
Mhm.
that's probably what convinced her to trust this guy and, like, do the treatment. So I feel like, that's just a quick example of, how long you know how connecting with your patients can go, I guess.
Right, right.
Yeah.
You gotta, and I wouldn't phrase it as gaining the trust of your patient. It's literally connecting with your patient to give them the treatment they need.
Yeah.
And I most of the time I do end up having to get a Spanish translator, especially early on, because you need to make sure that they understand
Right.
fully. And then there's the case where some interpreters don't know how to translate the medical terms either. But regardless, yeah, actually, just to touch on that point you said in Guatemala, you learn more in 1 week. I think it's because you were speaking it.
Yeah.
One of the things I found is I started with Duolingo like a year and about 2 years ago.
Mhm.
And it's great up to a certain point, but then it has you like rewriting things. And no, I'm not trying to read and write. I just want to speak and listen. And we got to make an app to do that. I mean, it's so fundamental. If you actually want to speak Spanish, you got to stop reading and writing it. You got to talk,
100%.
you know?
100%. Like,
It's so
throughout high
simple.
school, like vocab exams, like just spelling, like that stuff doesn't translate to speaking and conversing and understanding, because their
Not at
native
all.
tongue, the native tongue is so different from, like, hola, ¿cómo estás? Like, you know what I mean? So
Yeah.
it's gotta be deeper than that. It's gotta be more conversational. So, um, No, for
Oh,
sure.
and then you got the dialects, right? Because
Yeah,
Guatemala
there's different.
people speak
Exactly.
Dominican speaking of.
Yeah, when we were there was like an intake station and stuff. So, patients come, we think, oh, it's just Spanish. We got it. No, there's like over 100 different dialect, or maybe 30, like different dialects within Spanish. It's crazy. It's just, it blows my mind. But let's get back to, obstacles in undergrad.
Yeah,
What,
yeah.
what you got going on over there?
Oh, okay. So obstacles. Okay, so imagine yourself in high school and you just made your friend group after your first and second year. All these your buddies that you came in high school with, you got 2 more years together. You're going to apply to colleges together,
Mhm.
and now you switch to another school because athletics, external factors contributing, family, friends, sports, the future. Um, so that's kind of what happened. But when I switched, being on the basketball team wasn't what I thought. I thought I was gonna. I had a really good time on the basketball team. The coach was super understanding, where they would, if you had an exam, they'd let you out of practice early, or the coach, he would just say, "Don't come tonight. You have a final tomorrow. We get it." You know what I mean? Like, when I switched to Stevens, it wasn't like that. I was actually there was a biochemical, engineer, biomedical engineering guy on the team, but I was chemical biology, basically like pre-med. I was the only one on the team. Everyone else was business. There were a couple engineers. No, but it wasn't understand. There wasn't that understanding. And then hour and a half, 2 hour practices turned into 3.5 hour practice. I got to study, man. I'm not going to be a professional basketball player. I'm not going to be a basketball coach. Hopefully one day, maybe I will. I'd love to give back. But the fact is where, your career route is different. And we have to differentiate hobbies and kind of, where they are in terms of your life. I loved basketball growing up. I still do. I don't have time to play anymore, but it's I don't know. It's crazy how some things can turn from a hobby and like your love, passion, and just kind of get suffocated a little bit,
There's like a term for that. I forgot what it's called, but I felt the same way coming out of high school. Played like 3 years of varsity basketball, and like when I came here, obviously you're gonna be a little bit better than everyone else, but there's not that same like you lose your kind of sense of purpose. You're not like on a team anymore. You're just kind of playing it recreationally, and then you have to do, your pre-dental requirements or whatever you gotta do just to get in. So sometimes I feel like that, but honestly, basketball is something that keeps me like engaged in school. Honestly, like I feel like I do better in school when I get that fix.
Yeah, you get the
Very important.
release, escapism.
Exactly. Yeah. Yeah. It just kind of resets, your
Yep,
mind, you get out of it. Exactly. So what,
100%. Got
yeah,
to reach that once in a while.
for sure. For sure. So we're just gonna go right back into it. So, can you review your dental school application, like the process? How'd you kind of take it on?
Ooh, the applicate. So I told you I took a gap year.
Yep.
I finished, so we have to kind of picture this. I
Mm.
I studied for the DAT right when I graduated. So when we were really partying, graduating college and whatnot, I'd go out one night and I would miss the next night, kind of thing. I'd go to the Brooklyn Brewery tour, for example, but I didn't go out after that. Like, do I regret it? Those are experiences I missed out on, and we miss out a lot on this route of pre-health.
Mm.
But no, it's what I had to do because I had less than 2 months to study for the DAT. The way I structured it, though, this would really help undergrads, was I broke it up. So let me ask you, what's the one subject on the DAT exam that you don't learn anything about in dental school?
Probably just PAT.
PAT.
Yeah.
So I actually studied the PAT during winter break. So
Okay.
I just focused in on the PAT winter break, knocked it out in like 2.5 weeks, cracked that pat. That's what I used for that.
Yeah.
Starting in the summer, I went right into biochem, went right into general chem, orgo, right, reading, math, and basically just round the clock, just went between those subjects. However I did it, like you knock off one by one, and then you go DAT boot camp tests, and then I took the test, and it's all history from there. But yeah, less than 2 months, unfortunately. But you get the score you need, and you get into school.
Nice. Yeah. No, I think many people like try to cram stuff within like 6 weeks or something, but
Oh,
I guess it just depends on how different you are as a person. Like if you can do that, hey, dude, no one's stopping you. But like, if you set aside, like that's what I'm gonna do during winter break. I'm setting aside like a solid 2 3 months to just kind of grind it out, get it done. There's no like immediate rush. I want to make sure I have enough time to just kind of do it.
Yeah.
And I feel like that's where a gap year might come in, where some people feel like they have to rush to the DAT when, they got to finish their courses or they got to do whatever they got to do, life hits you. So,
Yeah.
people put themselves under pressure to finish like right away in 4 years. That's what you're supposed to do, right? So,
Right.
that's a huge, huge thing. And like, I think everyone that I've talked to on this podcast, they've probably half of them have taken 1 or 2 gap years. So like,
Yeah.
not like,
Really?
and the average matriculation, what is it, like a 26 or something? 20, like it's high there, it's high 20s for dental school.
Mm, I hope not.
Yeah, but
Maybe.
yeah, I don't know. So you took your DAT, you got your extracurriculars together, you're shadowing, whatever.
That's a high DAT score, man. Is it still at a 30?
Yeah, I think it's at 30.
And people are like, there were 20, 26s, 28s. So,
Oh, no. I mean like the age of matriculation into dental school, like how
I was gonna
No,
say,
no. It's not. No, it's not 20. It's not 20.
26. Again, I wouldn't have gotten in.
I think Stony Brook is like a 21 or something. 20 around there.
A little
20.
higher. Yeah, I think it's like a
21
22.
and a half, 20. Yeah, 22, something like that. I'm
Yeah,
not gonna say
actually, I mean, not an advertisement, but we put together, Sean and I, and we put together pre-dent mentor maps. So we kind of organized statistics for each dental school. It's a little higher for Stony Brook, from what I remember. But yeah, just the pre-dent mentor map is a good helpful tool for that.
Nice. We'll get into all that. I want to get into all that stuff, honestly. Like what
Do it, yeah.
ministry and delete it. We'll get into that. Now you got your DAT, you got all your scores together. So how did you go on choosing which dental school you wanted to apply to, and how did you kind of narrow it down to Stony Brook?
Okay, great question. This was kind of the first point in my life where I was applying. Like my parents helped me. What school you want to apply to? I had a guidance. We all have guidance counselors in high school.
Yeah.
Oh, what school you want to go to? What do you think you want to do? Blah blah blah. And playing basketball in college really kind of influenced that around athletics and around having a strong academic school, because I knew I kind of wanted to be pre-health along the way. But for dental school, it was like, well, I don't know, how many do you apply to? There's no, and that's kind of why we're creating this, that we'll go into in a bit. But it's like there's no guidance in undergrad for this. It's like word of mouth from anyone at your college that might have gone or is going into dentistry above you. Other than that, maybe you know a dentist. A lot of people have parents that are dentists that go into dental school. We learned that. But otherwise, there's no guidance. There's no guidance counselor for going into dentistry in college. So we're kind of trying to create that and more, which we'll go into. But the fact that, so I was looking in the area. I was like, well, I mean, I'm not going to go to Utah. I'm not going to go to Washington. I mean, I know Starbucks was founded up there. Other than that, I don't know. It rains a lot, I think. So let's stick in the area. Let's stick with something we know.
Sure.
I have family in Florida, so I applied to UF, Stony Brook, Columbia, Toro, Buffalo, Rutgers, and NYU, of course. So that's 7. I got interviews at everyone but Florida, because Florida is like 98% in state that they take. So fine, whatever. Interviewed at the rest, and then I kind of looked at what kind of attention are these students getting. And for me, after having shadowed Dr. Capuano, having the interest, prior to starting dental school, had somewhat of an interest going into oral surgery. Didn't know. I was open-minded, but I was like, this looks pretty sweet. And I was like, which school's going to give me the best opportunity to get into a specialty, right? And I was told you really kind of have to specialize for whatever reason. That's what the dentist had told me. And that really came down to, oh no, Columbia, I didn't apply to. Columbia, I didn't apply. I applied late, like November, and they already sent out all their applications. So I just wasted $80 or whatever it was at the time. But I applied to every other New York school and Rutgers. That's how it worked. It would have been Columbia or Stony Brook that has the best placement into specialties. That's really kind of why I picked Stony Brook. And the reason being is because Stony Brook's such a small school. If you're going to be a general dentist, you probably want to go to small school and get the best hands-on experience with your attendings. But I come to learn now, your experience at dental school is actually super important too. You got to be happy. You really have to be happy. So
yeah. So you got those interviews. Can you just run us through your interview process? Like what kind of questions were you prepared for? Were you not prepared for? What should the pre-dentals expect, going to those interviews?
Yeah, I had some stupid flashcards of like some kind of, someone told me like, oh, know these dental questions. I wasn't asked any dental questions. Tour was great. The attending sat me down. He's like, "You want to go here?" And we started talking about basketball for a half hour. His son played basketball. I played basketball. We're talking about basketball. It was
Yeah.
awesome. We didn't even talk dentistry. Stony Brook was great. The attending's not there anymore. He's Dr. Schwartz. But we were talking about. I told him my dad fly fishes. He fly fished in New Hampshire. Blah blah blah. Dr. Seaver there. He's still there. We were talking about his son, who's professional poker player, believe it or not.
Interesting.
NYU was cool because I knew the dean there. Kind of helps, right?
Nice. Yeah, always.
Rutgers was awesome because I knew someone was on the board there, who actually ended up being the person interviewing me. So, and he had a side company at the time, and I just wanted to pick his brain about the side company. So we talked about that. Yeah, so I mean, I like talking about people about things other than that. When we get to it, of course, I mean, you got to load up your resume, did the research, was in team atmospheres, mentored, was an organic chemistry tutor through, I hit all the bases, but I didn't want to talk about that. Just like we said earlier, talk about the people outside of the career.
No, for sure. I think that's, again, just nailing the point again. Perfect. So, now you're in dental school, you chose Stony Brook. Like, what was your experience with D1 and D4? How did you kind of see yourself evolve as a person and, really start honing in on, what you want to do after dental school?
Dental school is such a stressful environment.
Mhm.
Not gonna lie, a lot of it is kind of allowed by the teachers. The teachers could really kind of prevent that by, I mean, I haven't given a lot of thought in a while about how to kind of prevent what's going on. Well, first of all, teachers should change their chests from the year before. Second of all, I think we should actually get some applicable knowledge in some of these courses. Like, let's actually work on our hand skills. Like when you get into the sim lab, let's do more in the sim lab. Let's
Right.
build a bigger sim lab, right? And let's get less learning about the paradigm is super important, right? But you could talk about it with the patient a little bit, but for the most part, they want to know terms that they can understand. They're not going to know what the biological width at 0.86 millimeter, like we need more applicable stuff. I
Mhm.
mean, that's just my, we need to be talking about like, how do you actually run a practice? How
Right.
about practice management? Like dealing with problems in the workplace. Um, do you want to be an employee versus be an owner? This is very important because it's going to
Right.
play the it's going to play into the environment and the actual attitudes of the environment. Um, it's going to play a big on how you treat not how you treat patients, but what patients think of the atmosphere. Are they you just a money mill trying to get them out, or are you trying to sit them down and get to know them? Maybe they'll have, if it's Grandma Margaret, put implants in. Grandma, wants great grandma put the denture in, and then have little Sydney have her wisdom teeth taken out. It's just, I don't know. I love community dentistry. That's
Mhm.
kind of what I want to get into.
Mhm. Yeah. So, I think that was actually one of the questions I was going to ask you. Like, how applicable is that information towards, towards SimLab? And I think the same thing in undergrad. Like, I feel like some of the information is kind of, I mean, obviously undergrad, everyone's doing different things. So I understand like the curriculum might not be super applicable to, what you're going to do in the future. But I think that's a major change at, like our education system needs to make. I don't know. I feel like that just benefit everyone much more, to be honest. Um,
Yeah. Oh, it would. It would benefit everyone. Patients, doctors, you'd actually be happier with because you're going to know that this isn't about just becoming a dentist, it's about being happy with being a dentist every single day that you wake up. That's what we need to kind of push more in the curriculums at these dental schools. But now that we have dental schools that are being opened up by DSOs and a lot of
mm,
influential money being pushed in, who knows the direction it could go? It could go in a great direction. It could go in another direction.
yeah.
Power of influence is very strong when money gets put into play. But, anything can be done. The world is changing with the internet, social media, blockchain, NFTs. We'll see where it goes.
Mhm. Right. So, can you just kind of walk us through like what you had to experience, in each year of dental school? What was the, you know, when you start touching handpieces, when you start getting like the clinical based part of dental school, so pre-dentals can kind of get a good idea of, what to expect.
Yeah, yeah. We started touching hand pieces a couple weeks in dental morphology at Stony Brook, at least. When we started getting there, we were started with waxing. Hand pieces came in like a few months in. Um, that was that. And then we were taking the medical school courses until March, the first year, D1 year. Second year, we started to get more involved with pros, being fixed pros and removable pros. After January, February, we started in the clinic once every 2 weeks, I think, because they switch groups on Wednesdays. Third year, you're in clinic, I think 4 days a week. No, maybe a little about like 2 to 4 days a week. I think third year. Fourth year, you're in every day, basically. Right. Fourth year. So, I mean, gearing this towards the CBAC, I always recommend you got to learn how to balance studying for dental school, right? You got to get through dental school, and then managing clinic work, which comes later on. And on top of all that, studying for the CBAC. It's a lot to take on, but it's all about self-awareness, knowing how much time it takes you to study versus how much time you need in clinic. For me personally, I was always so stressed because I knew I wasn't as book smart as everyone else, but I could get the grades that I needed. I stuck with just A's and B's, but I knew I didn't have to practice as much for practicals and such. And knowing that actually played huge to my advantage.
Got you. So I wanted to ask this question, like, how did it feel, going from a typhoon or like a mannequin to actual people in dental school? Like, what was that transition like for you?
The first time it's interesting. Getting a patient numb is the biggest thing because that's what you start with. But also when you're getting someone numb, it's all feeling, right? They tell you the technique. Right. You put it over the opposite premolars, you inject, lateral to the pterygoum, the raphe. But when you're doing it, it's like, well, the needle's gone. I can't see anything now. I don't know where this is going, but for your first time, it could be a thing. And then all of a sudden they're numb, and you're like, all right, gastro, let's go.
Get it going. Exactly.
Yeah, so that's how it goes.
So, like, were there any, what kind of struggles did you face throughout dental school? Was there academic struggles, or was it just kind of like manual dexterity struggles?
No manual dexterity struggles. No, there wasn't academic struggles. There was more of academic, like understanding that I'm going to get there and just focus on how you learn rather than focusing. I'd be studying so much, and you study so much, you're just like reading, and not absorbing. Yeah. I could have just taken a step back and relaxed and said, let's put all this in Quizlet, study it a couple times, using figures. I'm a lot of people, visual learners. Mm-hmm. If I figured out how to do that with Quizlet earlier, I would have studied. It would have taken like a tenth of the time to study. Yeah. It really would have. But it's self-awareness.
So, wait, hold on. I think the Zoom meeting is about to end like in 40 minutes.
So that's a common struggle to all dental students. You're stressing so much, and then everyone else is stressing around you, and then boom, 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 it just rises up. I think the biggest takeaway to say is like, you're going to get to where you want to go, right? Learn the material, take your time. Whatever goes wrong, you're going to have an opportunity to correct it. For example, test scores, and everything will turn out just fine in the end. Mm-hmm. You need to enjoy the little pieces of dental school where you can.
And I feel like, the small class size at Stony Brook, like the faculty student ratio might help a lot, to be honest. Is that something that's true?
Yeah. Yeah. What for being a dentist? Yeah.
Yeah. Just for learning, honestly.
Yeah.
Yeah.
For sure. Oh yeah.
Yeah. So, now you're, getting through dental school. Something I really want to get to is, how did you decide to go the OMFS route?
I was kind of aiming. So very simple. If you aim for it in the beginning, I had an open mind, but I was aiming for oral surgery.
Okay.
What other residency requires a test to get into it?
No idea.
Ortho. Right? But ortho's, I think it's the GMAT. It's not as strict as an application requirement as the CBSE is. Okay. You know what I mean? So it's like, if you aim for oral surgery, it's like you could quickly mold and go into endo, go into ortho, go into peds. It's very manageable to go from oral surgery to other specialties. And a lot of people are interested in oral surgery. More than half our class was in the first few months of dental school. Mm-hmm. And then I don't know what happened. I'm still waiting for it.
So, how'd you decide to, again, applying to residency, right? How'd you list your schools, and did you kind of have did you like visit programs beforehand? Did you kind of just get a better understanding of which, each one had to offer to choose them?
Yeah, of course. The biggest thing is I didn't want to be overbearing, but I did want to express that I was interested in oral surgery from an early stage of D1 year, because then
Right.
you get to see which D4s when you're D1 match, right? Every year you get to see, okay,
Yeah.
Andrew Lolly's interested in oral surgery. Dan Vistardi, Ethan, I got to see all these guys match into oral surgery. So I got the best advice from them on specific programs. They would tell you, oh, you like this? You should check out this program. You should extern there. An externship is when you spend a week at the program, shadowing, observing, assisting, helping out in surgeries.
Mhm.
You got to get to see what a program's like. They get to see what you're like. I scheduled mine first at Montefiore, second here at NYU, third at VCU. So I got to see those programs. I was very interested in going to any one of those three and others, but I also planned on my externship trail very strategically because I wanted to go to powerhouse programs. So when you apply to, reach schools, I didn't
Yeah.
expect me to get into NYU, Monty, or VCU, but I extern there because you have a shot. I don't expect getting in there. If I do really well, now I get myself an interview. If I don't, well, I didn't expect it anyway. Two, on the application, it's known nationally that those are strong programs. So it's going to look good when you apply to other programs in other areas of the country.
Got you. So you just like put yourself in the best position, honestly, just in case, you were to get in. What
Exactly. Oh,
happened?
exactly. You always want to put yourself in the best case.
Yeah, for sure. So, I think you're in the 4-year program, right? I don't.
Oh yeah, thank God.
So what's like the main difference? Is it just the difference between the 6 and 4, just 2 years? Is that all it is, or is it more to, what you learn and how much you get to see and do?
It not a difference in what you get to see and do. Yes and no. You do those 2 years you're spent in medical school, right?
Right.
And you're getting your MD. That's what differentiates the 4 and 6. But guess what? 99% of oral surgeons do the same oral surgery.
Right.
There's that rare one guy, that gets his MD and then he goes into doing BBLs, breast surgery, tummy tucks. Dr. Tolomeo is who graduated from NYU here, young, awesome attending. That's what he ended up doing. But most don't end up doing that. And I looked at it head on because Dr. Capuano told me very early, look, if you're interested in oral surgery, unless you want to do breast implants, butt lifts, tummy tucks, you don't need your MD.
Right.
You could get out sooner. And on top of that, like 99% of programs, you need to pay for those 2 years of medical school.
Right.
Here at NYU, you don't, luckily,
Right.
but that's very important to keep in mind, right?
Right.
So why would you spend an extra 2 years learning about boats when you're going to be a car mechanic, for example?
Yeah, exactly.
It's literally what it comes down to.
Exactly. So like what's life like in residency now? This is your second year going into it?
Second year. Yep.
So what kind of stuff did you have to go through your first year?
First year, I started 5-6 months on anesthesia rotation, where you're a full-on anesthesia resident. After that, I did 6 months at the Bellevue Clinic as the intern, doing intern work, running the clinic, setting up OR cases. At that time, we didn't have a PA or coordinator. We were short-staffed in the clinic too for that time. There was a lot of work to be done. I'm talking 10 to 13-hour days, like never less than like usually 12 to 13-hour days at least. Wait, no, 6, 12, 13, sorry, 15-hour days. Working 6 days a week. And oh no, but it was a great time because like I was the guy in the clinic,
Yeah.
so I got to see basically every patient. So that was good. Now we transition to 6 months of rotations. You go off service. So you're in surgical specialties on the medicine side, right? General surgery rotations.
Yeah.
Here we do, my first was general surgery at the VA. Second was trauma surgery. Third, which I just got off 2 weeks ago, was hand and plastic surgery. Yeah, plastic
Right.
surgery also covers hand, and they combine it into one. So when you're on call overnight or on a weekend day, yeah, you're covering both services, hand and plastics, and it's a lot of work. You're on 24-hour call every third day, so you're on call 10 times that month that you're on. It's a lot to take in. Now I'm on bariatric surgery, and which is cool because now I'm in the OR every day. I'm assisting the bariatric attendings doing like gastric sleeves, laparoscopic sleeve gastrectomies, gastric bypasses, hernia repair, hiatal hernia repairs, when the stomach kind of goes up through the hiatal hernia, the sphincter.
Right.
And so stuff like that. Next, I do 1 quick month back at Bellevue in oral surgery, and then 2 months of medicine, doing what medicine does.
Yeah. So, what kind of different oral surgeries have you participated in or have you done? Maybe the most memorable ones, I guess. You must have like a few, right?
A few, not as many, because when you're an intern, at least you're doing mostly like intern work. Not as much OR in the first year, but I don't, the OR, I'm super like excited for it. The OR doesn't turn me on as much as other. When you're going into private practice, most oral surgeons, and when I want to get clinic based, I want to be doing a lot of sedations, wisdom teeth, implants, like
Yeah.
community dentistry. When you're in the OR, that's hospital based. Dr. Pruthi does a lot in the OR, and that's awesome and fascinating. But there's less OR time versus clinic time.
Mhm.
And I don't know. I just want to become an expert at clinical oral surgery. In the OR, I'll get there too, but you know what I mean. Like, so I'm not fretting anything because I wasn't in the OR every day, my first year. But the biggest oral surgery procedure that I saw in the OR was at VCU. It was a bicoronal flap where they make an incision on the top of the ear over the top of the skull to the top of the ear on the other side.
Right.
And essentially, this was a 41-year-old male. He had a long history, like 20 plus years of cocaine use. He did not have a nasal septum. He blew holes in the lateral sides of his, the maxillary sinuses on either side, there was a
Right.
hole. He had a hole going downward through the top of his palate too. So whenever he drank water, it went up into his nose. So he presented to the oral surgery clinic. He wanted to have that paddle defect repaired. So what they did was bicoronal flap. They took
Yeah.
his temporalis muscle on, actually it was the left side. The anterior portion, they cut it, went down underneath the zygomatic arch, burred a small hole in the posterior side of the maxilla, and then patched it into the superior aspect of the palate, right into the and did that. It's crazy. So his whole head,
That's crazy.
the scalp was folded forward to here. It was all the way down. Um, Nuts, just nuts surgery. It was a 12-hour surgery, 12, 13-hour surgery. There was blood all over the floor, blood tracking into the hallway. It was nuts. It was a great experience.
That's crazy. Dang. So, I mean, I guess that's kind of what I don't know. I feel like oral surgery is just a different beast from like, if you're doing a GPR residency or if you're doing an ortho, I guess. Um, we should have Sean on here also just to kind of give his perspective of things. But like, oral surgery is I feel like it's the closest thing to medicine from dentistry you can get.
Bingo.
And it's just like, you could just, I don't know, it's just super appealing to me, to be honest. I feel
It
like
is. It's
cool.
awesome. It's
Yeah.
awesome. The thing is, and any resident. So you have dentistry specialties. Any residency in dentistry that takes call is already another beast. I think a big part of healthcare is to know how to manage complications, whether it's in the operatory, whether it's in the OR, in the ED, the emergency room, or it's with your family at home.
Mhm.
You want to be someone that you could be looked upon for just a basic, but yet an emergency that you can help out with. That was something that I always thought was interesting. And GPR, pediatrics, and oral surgery take call.
Mhm.
I think it's a big part to these specialties that differentiates them from the other ones.
Gosh.
To call yourself a surgeon,
Right.
like an actual surgeon, you really know how to manage surgical complications. You do. So, I mean, I'm not there yet. I'm not a surgeon yet. I still have almost 3 years to go. But I think, when we call ourselves surgeons, you really kind of have to take in the aspect like, you put in the time to know how to manage complications.
Right. So what are your, you mentioned it, what are your goals and plans that you like to do after residency or, for the next 2 years? What do you plan on doing?
Oh, a lot. Through residency, working on. It's funny. It's like I have a big passion for. I want to eventually own like the oral surgery office that I work at.
Right.
Right. I think to get there, there's a lot of DSOs being going around these days buying
Right.
up other practices, which are fine and everything. But I think for me, I kind of want to mold and adapt the atmosphere of my office to how patients get comfortable.
Right.
How they, an atmosphere that they like, that they look forward to going to. Most people don't go to the dentist. Very fundamental, but it's true. And if you're not an owner, you can't really do that. And then at the most fundamental aspect, when you're in dental school, you might not realize this, but when you work for another dentist, you get to do all the procedures that dentist doesn't want to do. You don't get to do the procedures you want to do. Most commonly, they're maybe higher paid procedures. You're not doing any of them. That dentist is doing, because he owns the practice. So it's something like, if you want to own your practice one day, you got to market yourself, or you got to have the financials to open it up, right?
You have to
None of us have the financials, though.
Yeah.
What are you going to do?
Yeah.
Right.
So, I mean, I guess you have to work a little, you have to work a couple years, and then you can probably get yourself in a position for that.
Work a couple years, or, depending on how well you network, how well you market, maybe you could buy into a practice, maybe you get to know dentists, work in and buy into a practice. You're marketing yourself really well. You're starting this podcast. You're implementing the visuals.
Yeah.
Actually, I want to ask you questions about it, how you're chopping up the videos and whatnot. But, yeah, it's something we don't understand. Everyone thinks that they're going to graduate and then start marketing. You're behind the 8 ball.
I feel like you gotta just have that mentality first while you have the time to, you know what I mean? Like, you can't just get out and start doing that stuff later. It's gotta be now.
It's got to be now.
Yeah.
And you don't have to make perfect videos. You just got to try. That's what
you gotta get started, to be honest. Just gotta start doing stuff, and then eventually you can fine tune it later. But as long as you have like a foundation, like, I feel like that's what I'm trying to do. Once you have like a foundation, in the future, you're setting yourself up for like innovation, I guess. You can do that.
Yeah, and it doesn't even have to be dentistry. I mean, look at Brandon Axelrod.
Yeah.
He's got the balloon thing that he does, right? That's hilarious, but it's phenomenal.
Perfect. Yeah.
Think about that. He's got a client base in a pediatric population that by the time he's an oral surgeon, say he's an orthodontist, he's going to be putting braces on their teeth or taking out the wisdom teeth. Like, it's nice. It's nice to see,
It's perfect. So let's talk a little bit about your businesses now. I know you run Students of Dentistry, Elite Dentists, and Top Dental Practices. What is that? What it was called?
Yeah, Sean Czar, best friend from dental school. He's on Top Dental Practices, and we basically started all these together and more. We could go into. He's on Top Dental Practices. I'm on Elite Dentist. Brandon Axelrod is actually our manager of Students of Dentistry right now. And then so that's our dentistry things, and we have other things trending in the background that we need to gain some capital to afford a team that can manage them and build them. We actually have law. Well, we have medicine, right? So we have elite physicians, which we do get going again soon. Hopefully PAs. We have elite veterinarians for the veterinary space. And then our other big sector is law. We have top attorneys, top law firms, and top law students.
Right.
And top attorneys is the biggest one there. My mom's running it, believe it or not. And she's done a fantastic job.
Your mom's an attorney?
No, she's not.
Nice.
She's a background in marketing. I showed her how to do some things. She took it and ran with it. So
right. I feel like this is like a brand, right? Elite. It sounds like just a brand. Then you just kind of branching off into these different things.
Yeah. Top professionals. So that's the name of the LLC.
Yeah.
And it's not just about, we feature everyone for free, right? We try to promote, but it's about connecting the community together. That's really what it's about. And it's different niches, dental students, dentists, dental practices, but we're trying to bring bigger things to the space, right? And social media is starting to change, where there's TikTok now, there's YouTube Shorts, Facebook fan pages are getting back into it. You got LinkedIn for the professional community, and then you have podcasts, right? There's so many sites. It's very deep. But what we're trying to do is kind of so what I'm saying is, like, as Instagram is starting to diffusing where a lot of attention is going to other platforms, we're still trying to bring a bigger side of essentially what we're trying to do right now is we created the pre-dent mentor map, and we have many other maps coming as we build. But the pre-dent mentor map is to connect pre-dental students with current dental students that sign up with the map to be mentors for their specific school. So the pre-dental student can submit some questions that can be answered by hey, like, what do you like about the school? What don't you like? What would you recommend me doing in undergrad? Like, what did you do in undergrad? What's a good DAT study sort? Just simple questions, right? But what we'd like to do now is partner, and I don't want to reveal too much now because the partnership isn't sealed, but Wouldn't it be pretty cool if a current dental student can make a little bit of cash just from just literally helping the pre-dental student
Incentive.
process,
It's incentive for them too.
right?
Yeah.
100, $200 a month isn't much. It goes a long way as a dental student, right? 200 bucks, dude, that's almost groceries for a month,
Yeah.
right? Well, now with inflation, but you get it, right? So
No, that's
that's
cool.
kind of where we're looking to see. We literally, so what I saw, this is a side topic, I saw a lot of students that started side companies and whatnot throughout dental school.
Right.
They were like charging pre-dental students to get their knowledge, help them get into dental school. And I get that, but the way Sean and I saw it from the get-go was pre-dental students are like the calves, right? Don't you want to take down the cows? And what I mean by that is we're not taking down anyone, but you have these big dental marketing companies, loops companies.
Yeah.
I don't want to mention any names, but these loops companies have a lot of marketing dollars and they don't want to spend it because figs, Medico, and a lot of loops companies, they're getting away with free marketing from dental students, literally giving it away for a discount code. All right. They're giving away free marketing to companies that 10 years ago would spend 50 million trying to market to pre-dental students and whatnot. Those are the people I think we should be trying to gain funds from because we've created something that, you see what I'm saying?
Yeah.
We should be creating free, not treatment, right? But we're free help to pre-dental students and helping the bigger companies connect with the pre-dental students as like customers, but in an organic way where you're not ripping anyone off.
Like actual genuine information you're giving them.
Genuine information, right?
Yeah.
So our initial pitch was like, we're connecting pre-dental students with current dental students. We'd like to give a discount code for their next pair of loops to the current dental students, right? And then you could sponsor the entire pre-dent mentor map. And now every pre-dent that goes through this map is aware of oroscopic, designs for vision, Q-optics, whoever it may be. They didn't want to spend the money. We look, we weren't asking for a ridiculous amount compared to what they put into marketing year after year, but we're giving them an organic form of brand recognition. So we're gonna keep going at it, but pre-dents come first. Are you kidding me? Like we're trying to build something. So yeah, a lot of side topics there, but so this is kind of the direction we're going. Don't get malicious and try to feed off the calves. Is that, go after the bucks, the people that are established, the companies that have the money,
Yeah, for sure. That's a very deep conversation. And I feel like that's like the next level of what pre-dental advice can become. There's a lot of kids that will ask in our group chats, like our other pre-dentals, they'll just ask us questions which we might not be able to answer. And honestly, like you have this entire resource of dental students. You have these 69 dental schools. You got maybe freaking thousands of dental students ready to help you, but they're not doing anything because they're just doing their own work, but they're not, passing this information down. And so that's like the point of this podcast is, one by one, give a little bit of information out, tell everyone their stories and give them the contact information, just kind of, let them do whatever they want with that,
Yeah, exactly. Oh, and there's dimensions to this map too. We want people to connect with the dental students, and we make it easy for the dental student where it's literally just an email that pops into their email and they could just send it back. We've narrowed it down we try to make it just 3 questions. So it's super convenient for them. We've also made, you use Student Doctor Network?
I've heard of it. I don't use
right?
it. Yeah.
There's questions about dental schools residency for on Student Doctor Network, but there's no Student Doctor Network specifically for dental schools. We've created discussion boards on the pre-dent map so people can leave comments about the school, hear what the DAT actually might be, whatever. I don't know. We're getting there.
Yeah.
We want it to be useful.
Yeah, I think that's really important because there's not much pre-dental advising help. And I feel like even if there was, it wouldn't be like a direct source. It'd be like some male or female woman who's like in their 60s, probably never went to dental school. They don't have that first real experience. So, what you're doing is perfect. It's like first-hand experience. That's pretty important for people nowadays. So yeah, so everyone, you can follow Brandon at your Instagram. I'll put it somewhere in the description later. And his other 25 businesses he's got going on. And I know I watch like all of your reels that you put on, and they're so entertaining. Like, case studies, questions. I might get them wrong. I don't care. I don't really care. But
Thank you. Yeah.
yeah, just day in the life. You're on like day 500 now or something like that. I don't know, but
Getting there. We're getting there. Yeah. I try to do a lot of different dimensions. Like I tried to feed, like not feed, but I'm trying to connect with the community by providing, and that's what the questions of the day are. I can learn a little topic. You can learn a little topic, and then you got the day through residency, and then I repost Q&As. I don't know. It's try to make different
I'll do
content.
everything.
Yeah. What about you? So what's your next step? You are which year?
I'm a junior now, so third year going
Okay.
into probably going to start applying in June.
Good.
DAT the winter, get all the rec letters in and stuff. So I'm an Orgo 2 TA now. So I did Orgo 1 last semester.
Perfect.
So I guess rec letters there, whatever.
Perfect.
I've been assisting since January 2021.
Okay.
In the office. A lot of great experience. Honestly, like one of the best choices I ever could have made. Early in my freshman year, so second semester freshman year, I started January.
Yeah.
That's perfect. That honestly set me up for, it's just been motivation every single time I go into work. If I'm having a weird time, like I've talked this in past podcasts, but like, if I'm stuck in the books for an exam or something and I go to work, it reminds me like where I am,
Yeah.
Getting to do an exo or root canal, all these different things, crowns, fillings, all this stuff. Like it just kind of gets me back into it. Working with your hands, making temps, doing night guard, stuff like that. So honestly, it's a great experience. And on the side, I'm shadowing all these great people. Shadowing what we don't have in the office. We don't have endo, ortho, oral surgery. So, and I'm just shadowing those specialties. Just kind of get a little taste of everything. And
Great.
just chugging along, enjoying life. Just taking it day by day, I guess.
And so what's your next step, you think, as far so you're in the third year, you're going to take the DAT later this year, you're going to start studying over the winter. That's good.
Yep.
That's really good.
Yep.
What are you looking? I mean, you're shadowing, that's excellent. You'll get your letters of rec where you need in school as well as outside of school. You're getting connections, great connections that you're going to need when you apply to Stony Brook. So that's fantastic, as well as other schools.
Yeah.
What else? What else can I help you? What am I trying to think? How can I help you while I'm on this call?
Applying to like choosing which schools, to go for. And I feel like all the Northeast schools are definitely like what people do. If they go to Stony Brook, they kind of choose to stay somewhat close.
Yeah.
That's a whole conversation where I have to think about it and just kind of narrow down schools. And I feel like that could come after the DAT is taken.
Got it.
Then you understand where you are and where you can apply and stuff. So
exactly. Got it. Study for the
that I think that's just the next step, to be honest, getting out of the way. And then after that, personal statement, rec letters, stuff like that, all the basics. And then just go for it. And then really just trying to get this going, get this podcast thing out there and more popular and just, I don't even care if like 2 people listen to this, but those are 2 people. I've had 2 people that have texted me and like they listened to the whole thing and they've really been getting a lot from it. We had Zaid from Columbia come on.
Yep.
He talked about interviews. Brandon talked about interviews. One of my friends is going to Columbia. He just had an interview there, so he got some great tips from the interview process video, which we had. So, that just kind of that's motivation to keep doing this and just keep going. So,
yeah,
that's kind of where I'm at. Trying to keep healthy, just healthy and happy. That's the vibes.